Hi everyone and welcome to this risual public sector broadcast. Today I'm really pleased to be talking to our local MP Jeremy Lefroy about how we deliver successful health and social care. Hi everyone and welcome today. I'm really pleased to introduce Jeremy Lefroy here, who's our Conservative MP for the Stafford constituency. I wanted to start our questions today, Jeremy. Really pleased to have you here. Just to give a bit of introduction to who you are and really why you're so interested or passionate about the health and social care.
Well, thank you very much for having me. I've been the Member of Parliament since 2010 here, and I'm passionate about it partly for family reasons. I'm married to a doctor, I'm father of a medical student, I'm brother of a doctor, so health has been something that I've been related to, as it were, for many years. We've also had our particular problems in Stafford over the last few years, and we've also seen a lot of good and positive change in Stafford, but it's really made me appreciate just how important our health service and the health system in this country is to absolutely everybody, and also the link between health and social care, which is increasingly becoming a big topic of conversation, and more than that, something that we really have to solve, because it just isn't working properly in many places at the moment. And then I suppose I've had an international interest as well. In Parliament I chair the all-party group on malaria and neglected tropical diseases. We've seen huge progress in the tackling of infectious diseases like malaria over the last 15 years. Deaths from malaria have more than halved, and over the last 20 years have probably come down to pretty much a quarter of what they were. And we've seen excellent progress on HIV/AIDS and some progress, probably not enough on TB.
I hear you've been recently in Sierra Leone as well, meeting with some of the health minister over there.
Yes, I was there leading a group of volunteers, and I had the opportunity to meet the health minister and specifically talk about Ebola and how things are post-Ebola. One of the interesting points, or tragic points about Ebola, was that because people lost trust in the health system during Ebola, they therefore didn't go to get treatment for other killer diseases like malaria. And it's probably the case that more people additionally died from malaria during Ebola than actually died from Ebola, because they couldn't get or weren't able to go to the local health facilities, which just made it even more clear how important a properly functioning health system is in any country in the world.
Very tragic that, and obviously when you get in those kind of issues, those tragic issues on a national level, you really test the health economy, don't you?
You do. I mean, if you like, a positive side of it was that they've come out of that now, and they appreciate enormously the contribution that the United Kingdom made in Sierra Leone, not just the armed forces, but all those from the NHS and other organisations that went to help them. And one point that they made to me was what gave them great confidence that the world had finally taken notice of this disastrous situation was the presence of the Royal Fleet Auxiliary ship Argus, a hospital ship sitting in Sierra Leone, Freetown Harbour, with Merlin helicopters flying to and fro. So they thought finally people are waking up to the seriousness of this and what it's doing to our country, because it effectively shut the country down for several months.
And sometimes like that, something like that beacon of care, beacon of help really helps that situation, doesn't it?
Well, it does. And of course the Americans were doing the same in Liberia and the French in Guinea at the same time, but it was, although it was a bit late, it was an international response that stopped it from becoming a huge global pandemic, which it could have done.
So bring it closer to home, talking about here around health and social care environment. Can you give me your perspective on where you see the main challenges? I know you were part of the Health and Social Care Bill Committee, but can you give us your perspective where you think the challenges are closer to home in terms of delivering health and social care?
I think there are several challenges. First is the increase in need. With an ageing population, there is much greater call on services for health and particularly for social care. And we realise that, and we continue to realise that we aren't meeting that need. And I think that's the case across the world. This is not just a thing for the United Kingdom.
People are living longer, right?
People are living longer,
Positive
which
thing.
is a good thing. But when they do get ill when they're older, it tends to be complex conditions.
And multiple conditions.
Exactly, that's right. So that's the first thing. The second thing is that in the UK, our health funding has not really kept up with what we need. This government, the current government is putting a considerable amount of extra money in, but our spending on health as a proportion of GDP is quite a bit lower than the French and the Germans, and my view is we need to come up to, if not exactly that level, then something closer to that level, spending possibly up to 2% more, something like 35, 36 billion a year more, certainly on health, and possibly a bit more on social care as well.
And you've been petitioning hard for that even in recent months, haven't you?
Yes, and it's going to mean we have to pay more, so it means our national insurance will have to go up, or taxes or whatever. I prefer a national insurance system, a progressive national insurance system, but we are going to have to put more into it. There's no two ways about it. We can't kid ourselves that the money will come off some kind of magic money tree. It's got to come out of our pockets as taxpayers.
So people living longer, we need to put more into the health system, health and social care system.
And we need a much more joined up system. That doesn't necessarily mean we need one massive monolith of an organisation which is controlled from Whitehall, not at all. I do believe in local choices, local decisions, local flexibility. But it does mean those organisations have got to work closely together and not say, that's your problem, not my problem. I mean, if we let's just take a local example of something that's worked really well where organisations have come together. The Norton Bridge improvement on the West Coast Main Line, a massive project with a junction which will speed up train times. The Staffordshire Partnership, which is, I think 3 or 4 companies came together and said, look, instead of fighting each other over this, we're going to work together. Any problem is all of our problems and we're all going to solve it, rather than saying that's your problem, you sort it out, I'm not paying for that. And it worked. It came in under budget and it came in on time. The same was true with Terminal 5 at Heathrow. They adopted a similar approach where contractors work together, and that's what I believe we need in the health service. We see too much still of an organisation saying, sorry, I can't take that patient because it's going to cost me money out of my budget, whereas it's costing twice that amount of taxpayers' money out of another budget. So it's those kind of things that make absolutely no sense to me. And we see people stuck in hospital beds because there isn't care at home available at a much lower cost, because there isn't the budget in that, there isn't that care budget. But it's costing much more to keep people in hospital, and that drives me insane.
Well, I guess there's a couple of things there. One is, health and social care by default suggests that we've got to join up the NHS and what's typically delivered by local regional government in terms of health and social care. But also then there's a wider implication, as you say, I think, around interaction with charitable organisations. I know you're going to Macmillan Coffee Morning after this. I know a great charity helping a lot of people in need. Private entities and private organisations, in an era where we have health insurance, there's a lot more integration with private health insurances. Have you got any thoughts around that in terms of that kind of integration with the private health and other charitable organisations?
Yes, I don't like to draw too much of a distinction between public and private, because in some ways we've always had private organisations in the health service, and GPs are private organisations. What I would like to say is anybody who's delivering healthcare, and our system is almost all, if you like, public funded healthcare with some social organisations such as hospices, charities, some private organisations delivering part of that. The aim has got to be around the patient, not around the organisation. So it doesn't matter to me too much what the organisation is. I often prefer it to be charitable or social, but sometimes private organisations have an important role to play. But there are certain areas where it probably doesn't make sense, in like acute care. It's almost impossible for us and me to see a way in which acute care cannot be provided. It can be provided except through an NHS style system. So I don't think we should get too hung up about that, but what we should get hung up about is how those organisations work together, whether there is waste, whether there is inefficiency in that, and whether the patient is actually at the centre or not.
I think kind of looking at that, it's almost like the citizen lifetime life cycle, isn't it? And not just looking at the now, but looking at the future as well, and thinking about where funding now can help, particularly with young children education around dietary, drug and alcohol challenges, and seeing whether a funding now can help in 5 to 10 years' time as they go through this life cycle of change. Again, interacting with public sector entities, but changing that as they go through the life cycle, hopefully.
Yes, and I think helping people to take much more control over their personal health.
Yeah.
And that's not just physical health, that's mental health as
Yeah,
well.
yeah.
There are some serious issues around young people, mental health for everybody, but young people's mental health. I'm actually quite concerned about the impact of too much emphasis on social media, people sort of sitting in their room on their own with social media, and what that does for people's mental health. So a lot of health education, I think, is needed in schools and education establishments, which probably doesn't happen at the moment. And it's not just around less sugar, less salt, or whatever. It's around a holistic approach to life, getting much more exercise. I think we are very bad at encouraging exercise, and in Parliament now there's a sign on the lifts up to my office saying, why are you taking the lift? Save energy and improve your health. And actually, although I still don't do it enough, it does remind me. It says, I'm going to go up the 3 flights of stairs and not take the lift. And it's simple things like that where we can encourage people to take healthier lifestyle options. And I have to say, there's some encouraging things around. People are taking. I see far more people around taking exercise, cycling, or running or walking, rather than getting in the car. That is happening, but we need to do an awful lot more of that, and we need to help people in that.
So just on that mindset then, where are you seeing success specifically in health and social care in your role in the constituency or wider, and what can we learn from those pockets of success or those areas of success that you're seeing?
It's interesting. I'll start with an incident which isn't in the UK, or instance which is not from the UK, and that's in the case of malaria. 15 years ago, if you wanted to be tested for malaria, you'd have to get a blood sample taken, sent to a lab, and it might come back. It might be quite quick, or it might come back in hours or days later, by which time your condition might well have worsened. As a result of technology, things called rapid diagnostic tests have been developed for malaria, which means you can get an answer with any trained health worker, not qualified health worker, can be a volunteer, in a village which is quite remote, getting through a pinprick and on a strip, getting an answer within a few minutes of somebody who's got malaria, so that immediately the course of treatment, if they have, can start, and that has saved countless lives, particularly of children. Now, my view is that that technology can play an enormous role, and is playing an enormous role, in reducing the amount of time people have to spend in hospital. You just think of the way operations are done now compared with 20 years ago. People can recover much more quickly. That reduces bedtime. Britain already has probably the lowest bedtime per patient in normal circumstances of most developed countries. There are these techniques both in clinical skills, surgical skills, medical skills, and also in technology, which have transformed the way we do an awful lot of things. And in Stafford here, if I take a local example, the way, although it's been a very difficult time and we've lost some services we definitely didn't want to lose, at the same time, I've seen great improvements in things like cancer care, chemotherapy. We've got a brand new chemotherapy suite here, much better for patients, much better endoscopy unit here using the latest technology. So it's a question of both using those technological advancements that are coming all the time, but at the same time remembering that at the heart of health and social care is the person and the interaction between the professionals and volunteers who offer that care and the person themselves. So we mustn't, as we advance with technology, lose that personal touch, but we mustn't ignore technology.
Absolutely. I mean, it's interesting hearing that story around the kind of malaria pinprick that's in the jungle. I mean, if we look at those situations and see the challenges, the logistical challenges of doing that in those areas, then surely we can apply that to somebody that's dealing with long-term conditions like diabetes, to be able to ship these kind of packages out, track them, bring them back in, and save the movement in between hospitals of care.
And we're doing that, and that's happening all the time. And I see instances of that where people are able to stay at home, whereas 5-10 years ago they wouldn't be able to stay at home. And by and large, people want to stay in their own homes.
Yeah, absolutely.
They don't want to be in hospital.
No.
It's not a place that however nice the surroundings are, particularly older people, the amount of muscle use that they lose per day being in hospital is quite extraordinary. So somebody who is quite elderly, who goes into hospital, and I've seen really sad instances of this, who's been a really active 90-year-old and then has been in hospital for a few days or perhaps a few weeks longer, and they come out and they need a huge amount of care, and that shouldn't have happened. And that's where we want people to be able to live fulfilled lives, stay in their own homes as long as possible, and even if they do have a terminal condition, be able, with the support of brilliant people like Macmillan, to return home and have their last days at home. Hospitals should not be the centre. They're incredibly important, and when we have an emergency, especially, they're incredibly important, but they shouldn't be the centre of what we think of as a health service and social care system.
So you mentioned something around technology within the answers there. Just reflecting on that, I guess information communications and technology and digital skills combined is obviously going to be part of anybody's sustainability and transformation plan. Why do you think it's specifically important to health and social care? I know you touched on this slightly here, but is there anything specifically around digital skills and IT that really is going to underpin the way that we change?
Well, what it should do, and we were talking earlier about this, is what I often see is that our health and social care system has pockets, and more than pockets, really big chunks of excellence interspersed with some pretty bad logistics or organisation. So typically you might find somebody goes to the GP, has a very good consultation, the GP arranges things, and then it falls into a black hole. And then it's sort of pulled out of a black hole, and they go to perhaps a hospital for some diagnostics, and that works really well, and they have excellent treatment or care. And then again, so it falls into a black hole. And what should have taken a relatively short period of time and would have saved everybody an awful lot of time and probably money is very extended, because somehow people aren't talking to each other, or systems aren't talking to each other. And it seems to me that technology, properly used, and that's all around human beings, has a real role to play in ensuring that sort of critical path of a patient's beginning, perhaps going to their GP, and ending, come out hopefully cured, better, is efficient, is smooth, and at the same time they know that they're in good hands, rather than the letters I get from time to time, and I'm sure they are the exception rather than the rule, but saying, this happened, this was good, then this was really bad, and then this was good, and this was excellent, and then this was really bad, and at the end of the day I feel quite bad about the whole thing, even though I know that I've had a lot of excellent care somewhere along the line. And technology surely should be able to help people to overcome that. Now, that doesn't mean that we don't have to use our brains and our intelligence in that as well, but it should be a good tool.
Yeah, I mean, it's interesting. Information and integration, very, very critical to that. But also the interaction with the person in that healthcare pathway. I mean, I know we're talking about moving from 18 months to 18 weeks, but even 18-week care pathways are still far too long in many instances. But the ability for technology for it to interact with the person that's receiving the care, and for them to give almost immediate commentary back on how they're feeling, rather than having to send a letter to you 18-20 weeks down the line to say, well, actually it's all happened and it was bad.
Well, you take, for instance, GP appointments. Some GPs understandably say, we'll give you 7 or 8 minutes and you can only raise one issue with us. So you come in and you say, I've got this problem, even though you may have 2 or 3 things you want to ask about. Sorry, you've got this one thing, we'll deal with that, and then come back for another one. Other GPs often offer 15-minute appointments and deal with everything on the spot. And because health you can't divide health into individual things. Often one thing may not seem related to another, but is related to another. So why not take that bit of extra time at the beginning, sort it out, and then allow the person to be dealt with as a whole, rather than as individual conditions. Now, I would say people should look at that, and that means, well, GPs will come back and say, well, that's ridiculous. That means we can't offer the number of appointments that we will be able to do, and that may involve some extra planning. It may mean that GPs have to cut their list sizes a little bit to 1,600 per full time, or whatever the national average is. But it would surely make a lot more sense for patients if that were to happen. That's just one small instance.
Yeah. Or alternatively, looking at channel shift in terms of using things like Skype and doing tele-mentoring or tele-coaching or telecare.
That has a lot of scope, but the personal interaction between clinician and patient is vital, and that you can't do that over Skype.
Yeah.
Now, it may well be in many cases that it's better, because if somebody cannot get to the doctor, or it's very difficult for them to, they could do that. But often a clinician can pick up things by being in the same room that they couldn't just over a telecommunication channel. So again, you've got to be sensible about that, but not ignore it and not say, well, there are no circumstances under which we would do that.
Yeah. So I know you've been involved in a number of charities around apprenticeships and getting good people, attaining and maintaining good people. Give us your perspective on digital skills in health and social care, and people in the service, and how we kind of improve that, or how that can be improved.
Well, I think it's very important, and I think it's typically digital skills have been seen to be used perhaps more in the private sector, but they're absolutely critical in the delivery of healthcare and other areas of the more public sector. Yeah. So I think it's very important that people don't see it as some kind of divide, but digital skills are important everywhere, as are the technological skills. I mean, the development of new devices, the interaction between digital and the actual devices that people are using. So, for instance, there will be developments so that treatments which up till now have only been able to be used in a hospital setting might be able to be used at home with equipment at home that is perhaps remotely controlled, but the patient is able to, who maybe needs a daily injection or something like that they themselves can't do. The equipment can help do that with them. So we shouldn't just think of digital as being all about computers and information, but it's also about the use of actual clinically useful technology.
Well, there's a massive marketplace at the moment for wearables, isn't there?
Yes.
Digital wearables and fitness wearables. I guess that's going to
have
well, I certainly see that as having a massive impact. We're also really seeing that in some cases around diabetes care to kind of paediatric, around pedometer steps.
And just think if you were able to have some kind of device that would warn you that you're quite likely to be approaching a stroke, and be able to preempt that, or be in a position where you could, within that golden hour, be properly treated, which stops you from having life-limiting and lifelong conditions thereafter, which are hugely difficult for you and very costly to manage.
Yeah, absolutely. Well, listen, this is a fascinating interview. I really appreciate your time and comments.
Well, thank you very much indeed.
And I hope that we can get some more time in the future to discuss some other interesting topics in this forum.
Thank you very much indeed.
Thank
You're
you.
welcome.
Cheers. So thank you everyone for joining in today. I really do hope that you found this an interesting conversation today. Obviously, this is one of many of public sector broadcasts we're doing, and we'd love to get your feedback. So please do like and share. Thank you.